have to really go into that a lot, because you wouldn't be here if you did not believe in the effectiveness of play therapy. You wouldn't be here if you didn't want to learn more about how you assess play therapy, which brings us to our next slide, which is the role of assessment in play therapy. So play therapy assessment is not just a one and done. They just don't come in, you hand them a bunch of formalized, standardized assessment tools, and then you're done. It should be a mixture of formal and informal assessment tools that look at not just how a child plays, but the way that they're communicating in the play, any theme that they have, not just the things they say, but what does their body look like when they play? Are they very stressed? Are they very anxious? Are they rigid in your playroom? Are they tearing apart your playroom? All of these things are things that you want to track and you want to pay attention to. So when you're looking at how do you do assessment, you want to say it's done in both formal and informal, both naturalized observation, which you do here, as well as by report, as well as those standardized instruments that are out there that are readily available for you to use, such as the SNAP and the Conners and the Vanderbilt and all of those other type of assessment diagnostic tests. We want to make sure that we pay attention to the child's developmental framework. If there's neurobiology, there's going to be a little bit of difference. One of the things that I used to like to assess for back when I used to work with the deaf population is I also would do like a language assessment. If I had the capability, I would want to talk to the child's teacher or the child's audiologist, because I need to know if the child is going to be understanding any of my tracking if I'm signing and they really don't know how to sign. Or maybe there's something that I'm signing one way and they sign it different in another, and I had to know that. So you want to know your developmental framework that you're operating in and what your child is able to respond to. So also keep into mind, you want to have a connection of cultural humility. Too often, sometimes we look at a child's behavior through what you believe is the expected type of behavior that they should have. And when a child demonstrates something that's differently, we are very quick to pathologize, I just messed up that word, give a pathological reason for why that child is behaving the way they did. And we see this in studies with minority children who are diagnosed at higher rates with ADHD. We see it with our rates of kids that are in foster care that are 5 times more likely to be medicated for behaviors because the behaviors are very external. So we really need to pay attention to all of the whole child when we're assessing. So assessment data should be supporting collaboratively what the parents are saying, what the school is saying or seeing, and any medical providers. You don't always want to be the lone wolf that's out here and I believe this is what's going on, but assessment is the whole frame of what you're doing with that child. So our ethical competence related to that is make sure that you are using tools that are within your scope of practice. So if you don't know any, or you're unsure of any, or you're not even sure how to implement or how to track a theme, then you want to make sure you get more exposure in those things to develop your competence. So those things are very, very important. Which brings us to our next slide, where we're going to kind of let's talk about the ethical and cultural considerations that you need to take into hand when you're working with a child